My name's Kim. I'm the New South Wales Fellowship Coordinator, and joining me is beautiful Shae Sandri. Shae, do you want to introduce yourself?
Hello, I'm Shae Sandri. I'm the National Student Placement Coordinator at Ramsay Healthcare, and we're really excited to have you. And as Kim said, this room is a bit more informal, and I'll be keeping an eye on the chat bar while Kim does her magic. But thanks for joining us tonight.
Okay, everybody, so I'll tell you a little bit about New South Wales first, I guess. So in New South Wales, we have 34 sites across Australia. There is across New South Wales. Of those 34, roughly 11 are located in Sydney Metro, and we have quite a few staggered around in the rural and regional areas. So if that's what you're interested in, we cover everything in New South Wales, pretty much that there is to offer. So of the 664 approved DRGs, which are like they're like approved Medicare type case groupings. Basically, we cover 661 of them. The only things that we don't cover are major trauma, major transplant, and major burns, because they require very specialised care. So I'm going to say we do maternity. So we have 5 maternity hospitals located within Sydney Metro, and then we have Wollongong Private in the Illawarra region. We have mental health facilities, we have rehabilitation facilities. Obviously we have lots of med surge because private healthcare tend to do a lot of we do approximately a third to 2/3 of the elective cases in Australia, and we do a large number of those in New South Wales. So I probably won't talk too much more, because I really want to find out what you guys are thinking, what questions you have and what you might like to know. So I will ask, if you have a question, if you can pop your hand up, use the little magic man hand in the reactions tab, which is this one. So you'll see here to raise your hand. It just means I'll be able to see you much easier. You'll pop to the top of my list and I can unmute you and get you to ask your question. So does anyone have any questions to start with? Oh, I got all excited then because it was hand up, but it was me. Let me lower my hand. Okay, so to get an idea, how many, Emily, wonderful Emily, and let me see if I can unmute you. Beautiful.
Hi, I just wanted to ask, because I'm just a little bit confused, is this new fellowship program what your, like, the 1-year nursing new grad program used to be, and it's now fellowship?
Yeah, so basically it is incorporating what our grad program used to be, our 12 months. So the first 12 months that you do is the old grad program. So the same study days, the same kind of basic build on the program. And then as part of the fellowship, there's the second year. So that's when you do either specialise in a specialty, or you do another rotation if you haven't quite found your niche, or you might do some leadership development, whatever the case might be. So it's really an extra year for you to really use the benefits that you can have, but you're not really a new grad anymore, so to speak. You've moved into that second year and you're starting to spread your wings a lot more and using those opportunities that are available. Does that answer your question? Yep, excellent, great, thanks Emily. Okay, Amanda, I can see you. There we
Hello.
go. Hi.
So I'm really interested in regional nursing. My biggest question is, what happens if, say, for example, I get the first year in the Orange hospital and something happens at home because I've got older parents and I have to move back to Sydney? How is that going to affect this fellowship program, not being able to continue through the 2 years?
Well, that's the beauty of Ramsay. Because we are a national company, we actually can transfer you within the company. So even if you you need to go back to Sydney, or let's say, for instance, you need to go back to Western Australia, we can actually liaise with the hospitals in the region where you're needing to go to see if we can get you a position. So if there's an open position, we can transfer you across into those positions. As Bernie and Carmel said, we're a big family, and I guess I'm not quite as articulate as they are, but I love to say to people, once we get our hooks into you, we really don't want to let you go. We want you to stay part of our family. So we do everything we possibly can to bend over backwards and keep you within our family. So if you needed to go back and go to Strathfield Private, we would move heaven and earth to try and get you a spot at Strathfield Private. And if we couldn't get it at Strathfield Private, we might go next best, say, I don't know, North Shore Private or Castle Crag or something. And then when one opened up at Strathfield, you know, you would be at the top of the queue for that.
And you would try and like level out the learning and the development that I would be like, say, for example, I had to move halfway through the second year. Obviously, I would be missing out on that developmental year. My biggest concern is that if I have to move to Sydney, how would my education be affected? Obviously, with COVID, it's something that you've really got to consider when it's a 2-year program, because a lot can happen in 2 years.
Absolutely. And the beauty of it is, you know, we don't think about your second year really until we start to come near the end of your first year, so that we can actually really look big picture and really give a dedicated, well, what do you want to do? Where do you want to go? And how do you want that second year to look like? So if you needed to move in that second year, and we've already had those discussions and started that planning, we would move that planning to your new facility. Now, there could be some issues with that. So let's just say you wanted to do mental health and the facility you needed to move near didn't have mental health, or there was no mental health near there, or maternity, or whatever the case might be. We might have to look at other options, but certainly would be a negotiated discussion with you. This is what we can potentially offer. This is what we planned. Where can we kind of meet to make it agreeable for you so that you're not missing out? Because we want to keep you in the company. We want to do what we can to make sure that you stay with us. Does that answer your question?
Yes, it does. Thank you.
Great. Thanks, Amanda. Fee, I can see you're there. I'll unmute you.
Hi, how are you? Yeah. Can you hear me?
I can. What can we do for you?
I'm an international student. We just want to ask, like, our requirement is that different from the domestic student when we apply for the fellowship program?
Look, in theory, no, but I always say to any international student I speak to, the two biggest blockers potentially for international students are meeting the English language requirements and meeting the visa requirements. And it's really helpful for our sites when they're assessing all the applications if you address all of that in your application. So I generally recommend to people, have your English language competency test completed, whether it's OET, PET, whatever you choose to do, and show that you're able to meet the requirements to be able to register, because we can't employ you unless you're able to register. And secondly, make sure what your visa options are. Are you eligible for a skilled graduate visa? Are you eligible for a bridging visa? Are you eligible to apply for permanent residency? All of those kind of things. So if you can show us that you know that you meet the requirements for a 485 skilled graduate visa, you know that you've got X amount of points as part of your application, etc., etc. So we don't turn away international students because you're international students. We want the best people, the right fit for our organisation, and people that really want to work for us. And it's really important that you say, yes, I do want to work for you, and here's me proving to you that I do, because here's my test results. If you don't have test results, and I know that sometimes you can't get in earlier in the year, you have to get in a bit later in the year. Show us you're booked. Hey, I haven't done my test yet. However, I have booked for this particular date. Here's my booking slip, or whatever the case might be. Does that answer your question?
Yeah, it is. Thank you. Yeah,
wonderful.
Yeah.
Thanks, Fee.
Thank you.
Bukola, I can see you're next. Hi.
Hi, Kim. Hi, Kim.
Lovely to meet you.
Nice meeting you, Kim. Can you hear me?
I can. What can I do for you?
Okay, thank you. Actually, I have two questions.
Yep.
My first question is, as undergraduate nursing students that rounding up and ending of the year, I think around October, November, when can I apply for the fellowship?
Okay, so you'll be finishing at the end of the year. So you want the 2023 program?
Yes.
Okay, usually I wouldn't quote me on this because it can potentially change, but usually they open late May, early June. But I really strongly recommend to people to keep an eye on the Ramsay Careers webpage. Just pop in, once a week or so. But there should also be an option on there for you to be able to express your interest. And if you sign up to that expressions of interest, when our applications open, you should receive an automated email from us saying applications are open on this date.
You mean it's going to open this year, not next year, for the undergraduate finishing ending of the year?
At the end of next year, you're finishing?
No, this year.
This year, yep. So for the February program, you'll want February 2022.
Yep.
You apply this year. So they open May, June.
Next year or this year?
This year.
Oh, cool. That's okay. Me.
So the applications are open from, let's just say, early June to early July. And then there's a processing period, then there's an interview period, then we do offers. And offers are usually made around September, October, ready to get you onboarded for the February intake.
Awesome.
So, yeah, if you need a February 2023 program, you need to apply this year.
This year, thank you.
This year.
My second.
Your second question?
You want to say something?
No, I was just wondering what your second question was.
Okay, my second question, which is the last question. Tamworth branch. What type of ward do you have in Tamworth?
In Tamara, okay, so it's called Tamara Private and it's located in Tamworth. They have rehabilitation and medical surgical nursing. Okay,
2 wards. You have 2 wards.
I couldn't tell you if they have 2. I've got a feeling they may even have 3. They do day surgery as well, but it's certainly a very busy med surge. They've got 4 or 5 theatres that run, and they have a rehab component to that as well.
Okay. Thank you.
No problem.
Yeah.
Lovely to speak to you.
Nice hearing from you.
Okay, does anyone else have any questions? I can see Shae's been busily typing. Shae, do we have anything we need to address? Or you've taken care of it all?
I'm typing away, and just one for you that's just come up if you want that I haven't yet responded to, Kim, if you don't mind. Someone's asked, can we apply for the program more than once? For example, can we apply both at the beginning of the year and the mid-year intake?
Absolutely. And look, I recommend that you do, particularly if you really, really want to work for Ramsay Health. There's no limit on how many times you can apply. The only thing that would potentially hinder your application if you're doing a repeat application is if you completed a graduate program somewhere else first. So if you do that, you would need to apply as a registered nurse, not as a graduate. Does that make sense? Yeah, I hope whoever asked the question, that makes sense to you. So yes, you can if you haven't completed a graduate program anywhere else.
Hi, Kim. Thank you for answering my question. That was my question.
No worries.
I also had another question. So I'm really interested in applying for Westmead or Strathfield Private here in South Wales. How can I know what specialty areas each hospital is offering?
Jump on the web page.
The web page.
So
okay.
Shae put up Ramsay Careers for you in the chat bar. If you click on the Ramsay Careers link and pop in and have a look. If you go to the graduate tab and then click on hospitals, it'll bring up a map of Australia, and if you click on New South Wales, you'll be able to find Ramsey, it's a little bit complicated, or you can just type in Westmead Private into Google if you like, and go and have a look. The hospital web pages talk a lot about the hospitals, and I'll give this hot tip to all 48 of you online at the moment. If you know a lot about the hospital you're applying to and you talk about that in your application letter, it increases your chance of coming through, because we know that you've done your research and we know that you've looked up your facility. So there's lots of information to be found if you Google the hospital that you're looking for. So for instance, Nithya, Westmead Private and Westmead Private has robotic surgery. They do a lot of robotic surgery. So, you know, you can talk about that. You can go and see what specialties they do. They do a lot of neurosurgery for the CAFAT patients. So they've got a very big focus on neurosurgery. A lot of bariatric surgery. Westmead is one of our biggest centres in New South Wales. So our big three, I call them, are the ones that are Westmead Private, North Shore Private and St George Private, and they have in excess of 12 operating theatres per hospital. So North Shore has about 22, which is pretty big. So they're all in excess of 300 bed facilities, which mean they do most specialties or most acute surgical specialties.
Thank you very much, Kim.
You're welcome.
Perfectly answers my question. Thank you.
Excellent. No problem. Cara, hi. I can see that you've got your hand up.
Hello. So I'm actually a Queensland-based student, but I'm going to be relocating to New South Wales. So I'm going to be applying for New South Wales grad programs. And I just wanted to know if there's any sort of helpful advice you can give for an interstate applicant in terms of if there's any consideration for any additional practice considerations or, you know, medicines and poisons acts and things like that that you can offer just to help with our application process, but also just just in general practice when I move into practice.
Yeah. So between Queensland and New South Wales, there's not a huge amount of difference. There might be terminologies might be different. So we have clinical nurse specialists, whereas up there you have CNs. You have I can't even think what they're called, but we have NUMs. It's like it's a little bit different in the terminologies. Medications and things, don't stress on too much, because we really go into depth usually at a hospital orientation about the differences in medications and what you need to do for your dangerous drugs. In regards to your application, I would say to anyone, particularly if you're relocating state or if you're moving a long distance, be very clear why you're moving. So if you've got a personal reason that you're moving, make sure you say, yes, it's a personal reason, but I'm moving anyway, because that lets them know you're not just going just for the job, even though you want the job. It lets them know that it's going to be a long-term thing. In the past, we found sometimes that people, when they're transferring interstate, particularly if they're going just for that job, get really homesick, and it makes it really tricky. And some facilities might balk at that, most don't, but some, if they've been bitten more than once, will feel a little bit concerned about that. So if you're very clear on the reason why you're moving and that it is a permanent move. That being said, there's no reason why you couldn't move to New South Wales for a little while and take that job and then transfer back to a Ramsey facility in Queensland.
Great, thank you so much.
Does that help?
Yeah, that was very helpful. Thank you.
Awesome. Thanks, Cara.
Kim, I've just noticed it's just gone 8 o'clock. I'm mindful of everyone's time. We've got a couple more questions there. Did you want to choose one of those to answer just off the chat bar, and I'll keep responding?
Sure, I can try. My chat bar's not very cooperative.
Oh, sorry. How about this one? If we were able to complete the program part-time, would we be able to complete, for example, the foundation component in 2 years and then the development component in 1 year as full-time?
Nope, so it's all 2 years. So you can still do part-time, that's not a problem. We do say minimum of 3 days per week, which is what, roughly 24 hours a day, just to 24 hours a week, to make sure that you can 24 hours a day,
That's a bit
just to make sure, just to make sure that you can consolidate your learning. But it would be 2 years regardless. So it wouldn't end up being a 4-year or a 3-year program. So you don't need to worry about that. What else do we have? Oh, look, I answered another one, which was how many hours per week. Okay. Would requesting part-time lessen my chance of being hired? Absolutely not. Nursing is a female-dominated profession. So we understand that females in particular, not being sexist, males as well might need it also, but might need to work part-time for family commitments or whatever, maybe just for a work-life balance. So doing a part-time really does not inhibit your chances at all. Do you offer rotations in emergency at Lake Mac? Wouldn't quote me on this. You would need to email the coordinators at Lake Mac. They do offer rotations, but I think they're looking at second year rotations because the emergency department is an emergency department. They really like people to be able to demonstrate skills before they move in there. That being said, I know they have put people in critical care in their first year. So they've done a surgical, done a critical care, and then moved in their second year to the emergency department so that they've got all the necessary skills that they need for the emergency department and they can move forward from there. Great, thanks, Brianna. Okay, everyone. If there's no more questions, if you do have any questions, I think I just saw Shae pop it in, but if you do have any questions, please email Workforce Programs. But no, it's not. It's workforceplanning@ramseyhealth.com.au, and we would be pleased to get back to you and answer all the questions that you have. We look forward to hopefully seeing all your happy smiley faces in the orientations in the future periods. So good luck, everyone, on your applications. Don't forget to ask those questions. Feel free to email them through, and we look forward to speaking to you all soon.
Bye.
Bye.
Thank you all for your time. Well done. Good job,
Thanks.
Kim.
Thanks
See you.
so much, Shae. Bye, everyone.
Thank you.
Hi, sorry, I've got a question. I've just come from the Victorian breakout room. I'm moving up to the Albury-Wodonga area at the end of the year, and I'm looking to just looking at all the graduate programs around there at different hospitals and sites. Just looking to see what sort of services the Albury-Wodonga private Ramsay site offers in regards to the graduate program.
Okay, so Albury-Wodonga, well, do you mean Albury-Wodonga private or do you mean the Albury-Wodonga area, because there's border cancer as well?
Albury-Wodonga private.
Okay, so Albury-Wodonga offer acute med surg, and they have mental health as well. There's a rehab unit also. And they do a little bit of day oncology there, I think, like infusion centres. Your best bet, Shae, do you know off the top of your head?
I would suggest you're bang on there, Kim. I agree with everything that you said. But also, if you go to the website, there's a list of just hospital information. It's all of their specialties where you can find out how many beds, what they do. But it's a really great site there because they work really closely with the border cancer, as Kim said. Albury-Wodonga and Murray Valley work as a really great team there. So lots of opportunity. So good on you. You've chosen a nice spot.
I've just come from the Victorian breakout room. I was just looking at the Murray Valley private section on Ramsay Health, and looks like they're just a rehab specific site. So I haven't had a chance to look at the Albury-Wodonga private hospital site at all. So yeah, I just wanted to ask a quick question before the thing was over.
Good on you. But no, I'd check it out just at the website so you get all the specific details for the opportunities there. Great.
Thank you so much.
See you. Have a good night.
See you later. Good luck.
Thank you.
Awesome. Well, thanks, Shae. I guess we'll go now.
Super. Well done, Kim. See you. Bye.
Talk soon. Thanks. Bye.